Yes, in this session, I'm going to show you the location of the heart in this 3D model. So, and also the inner structure of the heart. So you will be able to understand the heart structure and various parts of the heart. Okay. So this heart is located in the mediastinum. Mediastinum is a place between the two lungs. Okay. So this is the sternum bone. I remove, you can see two bones here, these two lungs here, the right lung and the left lung. So in between this place you can see the place, this place is called as a mediastinum. This place is called as a mediastinum, and we divide this part into superior and inferior mediastinum. Okay, so this is the superior mediastinum and this is the inferior mediastinum. So this inferior mediastinum is divided into anterior, middle and posterior mediastinum. Anterior, middle and posterior mediastinum. So in fact the heart is located in the middle and the posterior mediastinum. This is the exact location of the heart. Okay, this is the exact location of the heart. Underneath you can see the diaphragm. This is the diaphragm muscles. This is the diaphragm muscle, and okay, so and this is the place where the heart is located. This is the place where the heart is located. Okay, this is the place where the heart is located. If you look into it, just a minute. Okay, and this is the exact location of the heart. Okay, and the heart size will be the size of a fist of a person. The heart size will be the size of the fist of a person, and inferiorly you can see the diaphragm, and in the lateral side you have two lungs, and superiorly you have the great vessels. These are all the big major blood vessels. Okay, if I remove the skeleton and the lung, you can see the major blood vessels in the superior aspect of the heart, in the superior mediastinum. Okay, so now what we are going to do is we are going to look into the membranes, okay, layers of the heart. Okay, this heart, it has three layers, that is the outer pericardium, middle myocardium and the inner endocardium. Okay, pericardium itself is having two type of layers. One is the parietal pericardium, the outermost layer. This is which is a fibrous pericardium, and deep to that you have the visceral pericardium. You have the visceral pericardium. Okay, you can see this is the parietal pericardium. I remove that, and this is the parietal layer of serous pericardium. Okay, and this is the visceral layer of the serous pericardium. So what happens? These layers, they secrete, this membrane, they secrete the fluids. In fact, this is the parietal pericardium. You can see the inside, it is covering the whole heart. It is covering the whole heart, and the deep to that you have the visceral pericardium. Okay, you have the visceral pericardium. So there is a space between this parietal and the visceral pericardium. We call it as pericardial space. We call it as pericardial space. This pericardial space contains the pericardial fluid of 10 to 15 ml of pericardial fluid that is lubricating around the joint and prevents the friction between the parietal and visceral pericardium. Okay, now when we remove this serous layer which secretes the pericardial fluid, we can see the actual heart. Okay, that is nothing but this around the heart there are a lot of fat bed. Okay, this is the pericardial fat. So much amount of fat is present. This fat is supporting the whole blood vessels, that is the coronary arteries and the veins. Okay, this is the pericardial fat bed. Now if you see, actually what you see is the myocardium of the heart. This is the muscle layer of the heart. Okay, so this myocardium is thick. in the ventricle, and it's very thin. For I will show you the thickness. See here, if you see the thickness of the myocardium, if you see the thickness of the myocardium in the ventricle, you can see how much thickness the myocardium is. Whereas in the atrium, if you see the thickness of the myocardium, you can see this is the thickness of the myocardium. You can see how thin is the myocardium of the atrium, how thin the myocardium of the atrium is. Okay, so deeper to that, you have the endocardium, which is called as the endothelial layer. This is the endocardium. This endothelial layer grows inside and forms these papillary muscles, and it forms these valves inside, okay, in the right heart as well as in the left heart. Okay, and it is also present in between the right and the left chambers. Okay, so when you want to understand further about the heart, I have to show you the actual cut section of the heart. Okay, so it's better I show you in the form of a diagram. It's better I show you in the form of a diagram. So what you see here is, let me draw and explain for you, so it will be easy for you to understand. Okay, so here this is the right heart, this is the right heart, and this is the left heart, this is the left heart, this is the left heart. Okay, now I want to erase this line. Okay, and okay, okay, this is the right heart and this is the left heart. Okay, why I have drawn the right heart in blue color and the left heart in red color? Because the right heart circulates the deoxygenated blood, that is, blood from all parts of the body comes through this superior vena cava. This is the there is a big blood vessel, there is a big blood vessel that is called as the superior vena cava. Okay, this is, and this is the inferior vena cava, inferior vena cava, IVC, SVC and the IVC. Okay, so that is, they will be like this, they will be like this. Okay, this is SVC, superior vena cava, IVC. Okay, the venous blood from the part of the body above the heart will drain through this superior vena cava into the right atrium, and the blood from the lower part of the heart, I mean the body of the lower part of the heart, will drain through the inferior vena cava. In fact, this inferior vena cava is the largest blood vessel. It's the largest blood vessel, largest vein in the body. Okay, the large veins, they don't have valves inside. Okay, and they come and pour into the right atrium. So the right atrium is said to be the largest chamber. Okay, so this right atrium is opening into the right ventricle. It's opening into the right ventricle. Okay, so if you see here, okay, the right ventricle is like this. Okay, so this is the right ventricle. So what happens, this is the right side wall between the atrium and the ventricle. So this is right atrioventricular septum. Okay, this is the wall between the two atrium. So that is interatrial septum. This is a wall between two ventricles, so it is interventricular septum. This is the wall between the left atrium and the left ventricle, so left atrioventricular septum. So here you have the tricuspid wall, which is having three cusp, TB. Okay, so what happens, blood comes from here and drains into the right atrium, and you can also see one hole. This is called as coronary sinus, where the venous blood of the heart comes and pours inside. Okay, so all the blood comes to the right atrium, venous blood, and then it has to come to the right ventricle. It has to come to the right ventricle. Okay, so here the venous blood is present. The venous blood is present here. Okay, now what you can do is, you from the vein ventricle, the blood has to go to the lung. The blood has to go to the lung. Okay, so here there is one blood vessel called as the pulmonary trunk. Okay, this is the pulmonary trunk. Pulmonary trunk. So what happens when this right ventricle contracts? There is a valve here that is called as a semilunar valve or the pulmonary valve. So once the atrium contracts, this tricuspid wall will open and send the blood to the right ventricle. From the when right ventricle contracts, the tricuspid wall will close and the pulmonary valve will open, and through this the blood will go directly to the lung for deoxygenation. Okay, so this is the heart, this is the lung, and this is the body. Okay, this is the body. So the circulation between the heart and the lung is called as the pulmonary circulation. The circulation between the heart and the body is called as systemic circulation. It is called as systemic circulation. Okay, so this is what you have to understand between the pulmonary circulation and systemic circulation. So okay, now what happens? The blood has gone to the lung. What is the role of the lung? The role of the lung is to purify the blood, that is make the oxygenation into, deoxygenated blood into oxygenated blood. So from there what happens? The blood will come back to the heart through the pulmonary veins. This is the pulmonary veins. There are two pairs of pulmonary veins. So they open into the left atrium and they pour in the left atrium. Okay, from here when the atrium contracts, through the bicuspid wall or mitral valve, the blood comes to the left ventricle. This is the largest chamber. The left ventricle is said to be the largest chamber with 70 ml capacity. Okay, the left ventricle. I will show you one by one. Okay, from here when the left ventricle contracts, there is an opening of aorta. There is an opening of aorta in the left ventricle, and this aorta goes to all parts of the body. This aorta goes to all parts of the body. Here you have the aortic valve. So through this route, the oxygenated blood goes to all parts of the body. Okay, this is the mechanism that is. So now I am going to show you the chambers from one by one. Okay, so if you see what I will do, I will remove all the other structures so that it will be clearly visible for you. So okay, what you see here is the parietal pericardium. I will remove this. I will remove the pericardial fat bed also. Okay, now what you see, this is the superior vena cava. Okay, this is the superior vena cava, and this comes and opens into the right atrium here. Okay, and this is the inferior vena cava. This is the inferior vena cava. This whole is in. So this also comes and opens into the right atrium. So if I open the right atrium now, if I open the right atrium now, you can see this is the right atrium, and this part is the opening of superior and inferior vena cava. Here you can see there is a pit called as a fossa ovalis. Okay, so in the intrauterine life, this is called a septum primum. Okay, through this hole there will be a hole actually. So the blood will go from right heart to left heart directly, because child is not breathing. So the oxygenated blood that is coming from the mother is directly going into the left atrium and then to the left ventricle and then to the child's body. So after birth this will fuse. Okay, that's why this pit is called as fossa ovalis. Okay, and in the side you can see a small hole. This is called as a coronary sinus. You can see a small hole here. This is called as coronary sinus. What is this coronary sinus? All the venous veins of the heart, all the veins of the heart will be draining into the all the veins of the heart, you see. Okay, here you can see this is the coronary sinus. So this coronary sinus opens into the right atrium. That's a vein of the heart. This is nothing but vein of the heart. This is nothing but vein of the heart. Okay, so that is the coronary sinus. And now through this atrium, through this auricle, blood will be coming to this auricle and it enters into the right ventricle. This is the actual right ventricle. This is the actual right ventricle. Okay, so what happens, this wall is called as the right atrioventricular wall, also called as the tricuspid wall. Why it is called as tricuspid wall? Because it is having three cusps, 1 2 3. Okay, this cusp is attached to a thread like structure. This is called as chordae tendineae. This thread like structure is called as the chordae tendineae. So when I open the right ventricle and show you, this chordae tendineae is attached to the papillary muscle. There will be three papillary muscles. You see, this is one papillary muscle and this is another papillary muscle. This is another papillary muscle and this is another papillary muscle. These are the three papillary muscles. Okay, these are the three papillary muscles to which the chordae tendineae is attached. You can see the attachment of chordae tendineae to this papillary muscle. So what happens during the time of atrial systole? This papillary muscle will contract and it will pull this thread. So when the thread is pulled, the valve leaflet will open and all the blood from the atrial auricle will come into the ventricles. Okay, will come into the ventricles. I can pause and show you, and you can see how the valve is opening. This is systole. This is how the valve opens and allow the blood to drain back into the ventricle, and then it is closing. Rhythmically. Okay, so coming back here, from the right ventricle, blood is going through the pulmonary wall. Okay, these are all the semilunar walls. Semi means half. Okay, half moon. So if you see this wall here, this is a semilunar wall. This is made up of thick connective tissue. So what happens when the right ventricle is contracting? It opens like this, and then when the right ventricle dilates, it closes like this. Okay, it opens like this, allow the blood to pass through, and close like this. From the superior aspect, if you see, this is how it opens and it closes. Okay, so this is a semilunar wall. So from here what happens, the blood, this is called as a pulmonary trunk. It divides into right pulmonary trunk and the left pulmonary trunk. Okay, so you can see this branches is the right pulmonary going to right lung. Okay, this is going to the left pulmonary trunk, and the other side, this opening is called as the right pulmonary trunk. It is going to the right lung. Okay, Okay, now what you can see here is the blood have reached the lung. Okay, so from the right and left lung, blood has to come to the left atrium. Now we will go into the pure blood circulation. We will go into the pure blood circulation. Okay, so if you see here, this is the left auricle on left atrium. If you see the openings of the left atrium, what I will do, I will remove this aorta. Okay, then you can see these are the two pairs of pulmonary veins opening. Okay, you can see 1, 2, 3, 4. All these are openings of the pulmonary veins which brings oxygenated blood from the lungs towards the left atrium. Okay, towards the left atrium. Now what I will do, I will remove this, open this left atrium, and I will show you. Once I open the left atrium, okay, the left atrium will open into the left ventricle. Okay, the wall between the left atrium and the left ventricle is called as left atrioventricular wall, which is also called as a bicuspid wall, that is two cusp. Bicuspid wall is also called as mitral wall. This wall is more prone for stenosis. Stenosis means narrowing of the wall due to rheumatic fever or any other conditions or calcification, whatever it is. So here you see, you can see only two cusps. The same way the cardiac tendineae is attached the cardiac thread to the papillary muscle. So for that, now I have to open the left ventricle and show you. Okay, and this is the anatomical position. Now I will rotate the heart and I will open the bit of the left ventricle. Okay, so yeah, now I open the left ventricle. Now I have opened the left ventricle, and you see here, this is the pulmonary mitral wall, and this is attached to this papillary muscle. This papillary muscle is attached to the ventricular wall. Okay, so you can see this is the right ventricle and this is the left ventricle. From the left, left ventricle is said to be the largest chamber. The left ventricle is said to be the largest chamber. From the left ventricle, the blood has to go to the aorta. Okay, this aorta is said to be the largest blood vessel, largest artery, which is having 2.5 centimeter diameter. So where is the 2.5 centimeter diameter opening is present? Here, you see, this is the aortic wall. This is the aortic wall. Okay, what you have to understand is, in the aortic wall, that is a semilunar wall, there are two openings. You see, this one opening and two opening. This opening is called as the coronary ostium. This is the place where the coronary artery is starting. This is the place where the coronary artery is starting. Okay, you can see, I will show you how it starts. Okay, you see, this is the place where the coronary artery is starting, and it is right and the left coronary artery, and it is distributing to all parts of the heart. Okay, so when the ventricle contracts, what happens? The bicuspid wall will close and the aortic wall will open. Once the aortic wall opens, the chamber size is 70 ml. The left ventricular chamber size is 70 ml. This 70 ml of blood rushes. So if you want to see the aorta clear, I will remove the pulmonary trunk here. Okay. Okay, you can see, yeah, I will hide left auricle. Okay, now you can see, this is the left ventricle and this is the aorta. Okay, this is the aortic bulb. Okay, inside the bulb only, this is the aortic bulb, which is having 2.5 centimeter diameter. Okay, so here inside the aortic bulb we can see the aortic wall. Okay, so now this is the opening of the aorta in the left ventricle. So what happens when the blood will push fast in the aortic arch, this ascending aorta, arch of aorta and descending aorta, so thereby blood keeps distributed to all parts of the body. Okay, so this is how the blood is circulating in the heart. This is what we call it as internal circulation of the heart. This is what we call it as internal circulation of the heart. So now you know the valves, then you know the blood entry and exit. Okay, so this is what you have to understand. And coming to the coronary artery, you know, there is a right coronary artery and the left coronary artery. You have to keep this in mind. There is a right coronary artery and the left coronary artery. Okay, so the right coronary artery is present in the right, it is supplying blood to the right side of the heart, and the left coronary artery is supplying blood to the left side of the heart. Okay, left coronary artery is supplying blood to the left side of the heart. So what I will do is I will remove the other structures so that I will be able to isolate the coronary artery. The coronary artery is supplying the blood for the heart, isn't it? So the myocardium receives around 900 ml of blood per minute. The myocardium is receiving around 900 ml of blood, oxygenated blood per minute. Okay, it is receiving around 900 ml of oxygenated blood per minute. So that's what I'm going to show you now. So okay, if you see, okay, heart is, myocardium is very important muscular layer of the heart, which need continuous non-stop supply of the blood, to the heart. Okay, otherwise myocardium will die. So in heart attack, what happens? This blood stop, the coronary blood vessel is blocked, and that leads to heart attack. Okay, now what you can see is, this is the right side of the heart and this is the left side of the heart. Okay, so in the right side of the heart you have the coronary vessels. Okay, I will remove this wall. Okay, now you see the right coronary artery is clearly visible. Okay, as you know, the right coronary artery is starting in the cusp of the aortic wall. It is starting in the cusp of the aortic wall, and here if you see, this is the first branch is called as a conus branch, that is giving blood to the SA node. Okay, in the conduction system I will show you the SA node. Then this is continuing as a marginal branch, and then it is ending into the posterior interventricular septum. Okay, it is ending into the posterior interventricular septum. Likewise, the left coronary artery is starting in the aortic wall. The left coronary artery starting in the aortic wall, then it is coming all the way to the posterior marginal artery. It's also called as the circumflex branch of the left coronary artery, and thereby it is giving branch to the marginal branch and then the posterior interventricular branch. Okay, you know what study is telling is, like your the fingerprint, the coronary artery anatomy also is unique for each and every person. Okay, so everyone will have different type of coronary branching system. Okay, so in that there is something called right dominant circulation and left dominant circulation. That means what? The right side coronary artery will be supplying major part of the heart, and left side coronary artery will be supplying lesser part of the heart. Whereas if the person is left dominant coronary artery, the left coronary artery will be supplying major part of the heart, and the right coronary artery will be supplying lesser part of the heart. Suppose if this branch is blocked, the branch from the left coronary artery will be supplying the blood. That time the patient will be experiencing chest pain, severe myocardial heart attack pain, and the patient can survive. Suppose if the main blood vessel is blocked by any big embolus, then the patient will die in the first heart attack. So this is what you have to understand about the coronary anatomy. Okay, this is what you have to understand about the coronary anatomy. Okay, So next I will explain about the ECG. Next I will explain about the ECG.